Okay, so today we're going to demonstrate a portion of the assessment called the primary assessment. The primary assessment is where we're really just trying to get a handle on anything that's going to kill our patient within the next few minutes during our encounter, so any immediate life threats. Also, it's important to note that the primary assessment is the same regardless of which type of patient it is that you're going to be assessing. The only one difference you may notice is when we approach the patient, if we notice any immediate life-threatening bleeds, then we skip and go out of order of ABC and go CAB and address the life-threatening bleed first. So your primary assessment is going to begin as you approach your patient. You're going to kind of form a general impression of your patient. And really you're kind of looking for what does the patient look like, how are they presenting overall, and are there any immediate life threats? Again, think about that life-threatening bleeding. Is it obvious that they're not breathing? Things like that. We're also trying to kind of determine at this point, are they sick or are they not sick? So do we immediately need to drag them to the ambulance and start transporting and treating, or do we have some time to kind of figure out what's going on and figure out what we're going to do next? So to begin with our primary assessment, we're going to start with determining that general impression. So when we look at John sitting here, his skin color looks good. He's sitting up. He's spontaneously moving. We can see he's spontaneously breathing. He appears to be awake. So from that, we would determine that the patient has a good general impression. So at this point, we would say not sick. From there, we're going to move on and actually pin down his responsiveness. So, hey, John, are you okay?
Yeah, I'm doing okay.
Can you tell me what day it is today?
Yeah, it's Friday.
Friday. And what year is it?
2017.
And who's the President of the United States?
Trump.
And where are you right now?
In the classroom.
Okay, so at this point, we've determined that John is completely conscious, alert, and oriented. He's oriented to person, place, and time. He responds to his name, knows where he is, what day it is, all those answers. So we understand that he's fully conscious. So next, we're going to move on and assess his airway. Now, with John in particular, he just spoke to us. So because he spoke to us, we know that his airway is clear and patent, and we also know that he's breathing. In addition to that, we could kind of look and see, is he making any noises when he breathes, any type of noisy breathing, or anything unusual happening with his airway, like, say, a muffled voice, things like that. So we've assessed his responsiveness and his airway, so now we're going to move on and assess his breathing. So for that, it's kind of a look, listen, and feel thing. You want to look at his chest, look for equal expansion. Look at how hard is he working to breathe. Is he using a lot of accessory muscles? Is he involving his stomach a lot in his breathing? All those would be indicators of increased work of breathing. Once we get through that, we can apply a pulse ox and get a reading on him. So with our pulse ox on, we can see that John's SpO2 is 98%, so it really doesn't warrant any type of oxygen therapy at this point. In addition to the breathing, we're going to take a quick listen to his lung sounds. So always comparing one side to the other. And John's lungs sound clear. So at this point, there's no breathing issues. Moving on, we're going to check his circulation. An important component of circulation that a lot of people tend to miss is skin color, temperature, and whether they're dry or sweaty. So looking at John, his skin temperature is warm, his color is normal, he's not sweating, so his skin's good. In addition to that, we grab some pulses. We're looking for a good strong radial, or up here, a good strong carotid. John's pulses are present and they're within a normal range. So no real circulation issues to be concerned about. Kind of wrapping this all up at the end, if we did find something that was abnormal, say with his mentation, his level of consciousness, at that point we would try to determine what that is, and that's the D in your primary assessment, the disability. So does John have some type of medical issues that normally render him unresponsive or not normally responsive? If that's the case, then at that point we want to figure out what is his normal mental status and what has changed from that. and that's how we would determine the D and the disability. Or again, is he diabetic, low blood sugar, things like that. So that pretty well wraps it all up. Again, primary assessment, trying to find immediate life threats, anything that has to be corrected now, or anything that's going to kill our patient within the next few minutes.